1. Scenario: a 5-year-old presents with a high fever, headache, and severe neck stiffness. On examination, he is sensitive to light. What is the most likely diagnosis? Answer: bacterial meningitis. Reason: fever, neck stiffness, nuchal rigidity, and photophobia are classic symptoms of meningitis, which is an inflammation of the meninges. 2. Scenario: a 2-day-old neonate presents with respiratory distress and poor feeding. Blood cultures gross Streptococcus agalactiae. What is the classification of this infection? Answer: early onset neonatal sepsis meningitis eons. Reason: in newborns, Streptococcus agalactiae, group B Streptococcus, is the most common cause of early onset infection, typically occurring within the first 72 hours of life. 3. Scenario: a patient with sickle cell disease presents with symptoms of meningitis. Which group of organisms is this patient most susceptible to? Answer: encapsulated bacteria, especially Streptococcus pneumoniae. Reason: individuals with functional asplenia, such as those with sickle cell disease, have an increased susceptibility to encapsulated bacterial like S. pneumoniae, H. influenzae, and N. meningitis. 4. Scenario: a child presents with altered mental status, seizures, and behavioral changes rather than simple neck stiffness. What distinguishes this from meningitis? Answer: encephalitis. Reason: while both involve fever and headache, encephalitis specifically involves inflammation of the brain tissue, leading to altered mental status and behavioral changes, whereas meningitis primarily affects the meninges. 5. Scenario: a lumbar puncture is performed on a suspected meningitis patient. The CSF is turbid, with very high neutrophils, low glucose, 40 mg/dL, and high protein. What is the cause? Answer: acute bacterial meningitis, ABM. Reason: bacterial meningitis is characterized by a purulent appearance, predominant neutrophils, and marked hypoglycemia, low glucose, due to bacterial and neutrophilic metabolism. 6. Scenario: a child with suspected meningitis has clear CSF, a normal glucose level, and a predominance of lymphocytes. What is the likely etiology? Answer: viral aseptic meningitis. Reason: viral meningitis typically presents with clear CSF, normal glucose levels, and a lymphocytic rather than neutrophilic response. 7. Scenario: a patient with suspected meningitis presents with signs of significantly increased intracranial pressure. Should a lumbar puncture, LP, be performed immediately? Answer: no, the LP should be withheld or delayed. Reason: signs of increased intracranial pressure are a contraindication for an immediate lumbar puncture. 8. Scenario: you are examining a 2-year-old child. When you flex the child's neck, the hips and knees spontaneously flex. What is this sign called? Answer: Brudzinski's sign. Reason: Brudzinski's sign is a clinical indicator of meningeal irritation where passive neck flexion triggers spontaneous hip and knee flexion. 9. Scenario: a 6-year-old boy recovered from bacterial meningitis but now seems to struggle to hear when spoken to. What is the likely cause? Answer: hearing loss as a late complication of meningitis. Reason: hearing loss is a recognized permanent neurological sequela or late complication resulting from the inflammation associated with meningitis. 10. Scenario: a mother has been in close contact with her child who was just diagnosed with Neisseria meningitis. What prophylactic treatment is recommended for her? Answer: rifampicin, 10 mg/kg every 12 hours for 2 days. Reason: chemoprophylaxis with rifampicin is used for contacts of N. meningitis to eradicate nasopharyngeal carriage and prevent further transmission. Neurogenetic disorders. 11. Scenario: a 42-year-old woman gives birth to a baby with a flat facial profile and upslanted palpebral fissures. What is the most likely chromosomal cause? Answer: full trisomy 21. Reason: full trisomy, 3 copies of chromosome 21, accounts for 95% of Down syndrome cases, and the risk increases significantly with advanced maternal age, 100 for mothers aged 40-44. 12. Scenario: an infant is noted to have a single transverse palmar crease and a wide space between the first and second toes. What is the hallmark neurological feature of this condition? Answer: hypotonia. Reason: these physical markers, simian crease and saddle toe gap, a characteristic of Down syndrome, for which hypotonia is the hallmark neurological feature. 13. Scenario: a child with Down syndrome presents with sudden onset neck pain and a change in gait. What specific musculoskeletal complication should be investigated? Answer: atlanto-occipital subluxation. Reason: atlanto-occipital subluxation is a known associated complication in children with Down syndrome. 14. Scenario: a 15-month-old girl who was previously meeting all milestones begins to lose her ability to use her hands purposefully and starts repetitive hand wringing. What is the likely diagnosis? Answer: Rett syndrome. Reason: Rett syndrome primarily affects girls and is characterized by a period of normal development followed by rapid regression, stage 2, including the loss of purposeful hand skills and the appearance of hand wringing. 15. Scenario: genetic testing is ordered for a girl with suspected Rett syndrome. Which gene mutation is the clinician looking for? Answer: MECP2 gene mutation. Reason: most cases of Rett syndrome are caused by a mutation in the MECP2 gene. Muscle and neuromuscular disorders. 16. Scenario: a newborn is severely hypotonic at birth with a frog-like posture and a weak cry. The clinician notices the tongue is flickering. What is the diagnosis? Answer: Werdnig-Hoffmann disease, infantile spinal muscular atrophy type 1. Reason: severe hypotonia, frog-like posture, and tongue fasciculations, which are diagnostic, are classic signs of this autosomal recessive motor neuron disorder. 17. Scenario: a 10-year-old child presents with weakness that started in the legs and is now moving up to the arms 2 weeks after a viral infection. Reflexes are absent. What is the diagnosis? Answer: Guillain-Barré syndrome, GBS. Reason: GBS, or acute inflammatory demyelinating polyneuropathy, typically presents as a rapid, ascending, bilateral, symmetrical flaccid paralysis following a microbial infection. 18. Scenario: a patient with suspected GBS undergoes a lumbar puncture. What classic finding is expected in the CSF? Answer: cytoalbumin dissociation. Reason: cytoalbumin dissociation, where there is elevated protein in the CSF but a normal or only slightly increased white blood cell count, is diagnostic for GBS. 19. Scenario: a 12-year-old girl complains of drooping eyelids, ptosis, and double vision that gets worse at the end of the day but improves after a nap. What is the most likely diagnosis? Answer: juvenile myasthenia gravis. Reason: this autoimmune disorder affects the neuromuscular junction, causing muscle weakness that worsens with repetitive activity and improves with rest. 20. Scenario: to diagnose a patient with suspected myasthenia gravis, the doctor administers hydrophonium chloride IV. The patient's muscle strength improves almost immediately. What is this test called? Answer: Tensilin test. Reason: the Tensilin test uses hydrophonium chloride to briefly inhibit H degradation, showing rapid improvement in muscle activity in MG patients. 21. Scenario: a patient with myasthenia gravis presents with severe respiratory distress, difficulty swallowing, and extreme weakness. What is this emergency called? Answer: myasthenic crisis. Reason: a myasthenic crisis is a medical emergency involving severe weakness of the respiratory muscles, often precipitated by stress or infection. 22. Scenario: a myasthenia gravis patient takes too much anticholinesterase medication and presents with sweating, small pupils, and muscle twitching. What is occurring? Answer: cholinergic crisis. Reason: a cholinergic crisis results from excessive cholinesterase inhibition, leading to symptoms like fasciculation, sweating, and pupillary constriction. It is treated with atropine. 23. Scenario: a 5-year-old boy uses his hands to climb up his legs to stand from a sitting position. What is this sign called? Answer: Gowers' sign. Reason: Gowers' sign is a classic clinical indicator of proximal muscle weakness, typically seen in Duchenne muscular dystrophy. 24. Scenario: a boy presents with a Gowers' sign and very large-looking calf muscles that feel firm rather than strong. What is this called? Answer: pseudohypertrophy. Reason: in DMD, the calves enlarge not due to strength, but because muscle fibers are replaced by fat and collagen proliferation of connective tissue. 25. Scenario: a mother is a carrier for a mutation in the DMD gene. What is the chance her son will have Duchenne muscular dystrophy? Answer: 50%. Reason: DMD is an X-linked recessive disorder. A male child inheriting the affected X chromosome from a carrier mother will manifest the disease. 26. Scenario: a clinician suspects DMD in a young boy. What is the first biochemical sign they should look for in a blood test? Answer: greatly elevated serum creatine kinase, CK, levels. Reason: in the absence of dystrophin, the muscle membrane is damaged, leaking CK into the serum. This is consistently the first sign detected. 27. Scenario: a 15-year-old boy is still walking but has mild calf hypertrophy and elevated CK. His symptoms are much less severe than a typical DMD case. What is the likely diagnosis? Answer: Becker's muscular dystrophy, BMD. Reason: BMD is a milder, allelic variant of DMD where partially functional dystrophin is present, leading to later onset and slower progression. 28. Scenario: what is the primary cause of death for patients with Duchenne muscular dystrophy, usually occurring in their 20s? Answer: respiratory failure or heart failure. Reason: the disease progresses to involve the heart, cardiomyopathy, and respiratory muscles, leading to failure of these systems. Bone disorders and management. 29. Scenario: a clinician is managing a child with Duchenne muscular dystrophy. What medication might be prescribed to help reduce the rate of muscle deterioration? Answer: steroids. Reason: steroids have been shown to reduce the rate of muscle deterioration in patients with DMD. 30. Scenario: a student is asked to identify common skeletal dysplasias mentioned in the lecture overview. Which two are listed? Answer: achondroplasia and osteogenesis imperfecta. Reason: these are categorized as skeletal dysplasias under the diseases of bone section of the sources.